Hi, sorry, we're gonna have these videos in 3 separate ones because his mom was calling and it ended the video and I thought it was mine, so I hung up. But okay, anyways, so we were auscultating for vascular bruits. We did all of the locations except for the femoral, which is the groin area, and we're using the bell. So we're gonna go ahead and do that and listen. Okay, and I don't hear any bruits, so that's good. Now we're gonna percuss. We're gonna be doing timpani, which is timpani is just the normal feeling that you would feel when you're percussing. And then whenever you feel dullness, that's usually means it's over an organ. Not usually, it is. And so first we're gonna percuss the liver, and then check for that. So I'm gonna start up here and percuss and do timpani until I feel dullness, and that's when you hit the liver. And then I'm gonna start from the bottom and do the same thing and hit it again. And that's just allowing you to see how big the liver is, or like the size of it, which it should be 6 to 12 centimeters in size. Okay, and then now we're gonna palpate the liver, so we're just gonna be feeling for it. Okay, make sure that it's not bulging out or there's no tenderness. Was there any tenderness when I did that?
No, ma'am.
Okay, you can't see him. And now I'm gonna palpate the spleen. I shouldn't be able to feel the spleen or hear anything. I'm also going to percuss it and palpate it. So you shouldn't be able to, because that could be a sign that it's enlarged. Okay. Wait, why do I have this on? Sorry. Okay, I'm percussing, I'm palpating, spleen. Okay, and now we're going to palpate the kidneys. You shouldn't be able to feel these either, because then that means that they're enlarged or swollen. I'm just going to stick one hand underneath here, and then I'm going to push. Okay. And then next I'm going to palpate the inguinal glands, or the inguinal nodes, sorry. Horizontal to vertical, which those are just, I'm going to use a circular motion with my fingertips to do that. Okay, everything, no abnormal findings. And now I'm going to palpate the abdomen, so I'm going to move in that same direction, right upper, right lower, left upper, left lower. I'm going to push down 1 centimeter, push down 1 centimeter on, I don't know why I keep taking this off, and ask if there's any tenderness. Okay, any tenderness?
No.
Okay. Right lower, left upper, left lower. Is there any tenderness in any of those areas?
No, ma'am.
Okay. And now I'm going to push deeper, 5 to 8 centimeters, and I'm going to do the same thing in each quadrant. Any tenderness?
No.
Is it tickle? Okay. Now we're going to do the diastasis recti. I'm just going to hook my hands in the middle of his abdomen, and I'm going to have him do a crunch, and I'm going to make sure there's no split muscle and there's no gap. So go ahead and do a crunch. Okay. And there was no gap or anything in his abdomen muscles, so he's good. That can sometimes happen with pregnancy, with other things if you just tear it during an extraneous workout or something. But usually it'll go back to normal on its own, but sometimes if it's deep enough, then they will have to do surgery to stitch it back together. And now I'm going to percuss his CVA, or his costovertebral angle. This is just checking for kidney tenderness. And also we want to make sure there's no pyelonephritis or a kidney infection. So go ahead and sit up and turn around or your back to the camera. Okay, and I'm just checking on both sides where his kidneys are located. And I'm putting my hand here. Wait, sit up more. Put my hand here, and I'm just hitting my fist. Any tenderness?
Nope.
Any tenderness?
No.
Okay, so he has no tenderness, so he doesn't have a kidney infection, but if he did, that could indicate that he does. Okay. Okay, so now we're going to move to bedside neuro. We're just going to be doing AVPU, which stands for alert, verbal, pain, and unresponsiveness. So if I was checking his consciousness, his neuroconsciousness, I would just come in, and if his eyes were already open and he was alert and awake regularly without me doing anything, then that would be the letter A. And then if his eyes were closed and I had to use verbal cues or say something to him to make him regain consciousness, and then that would be V. So for instance, Ryan, and then he opens his eyes and he's conscious, then that's verbal. And then for pain, that's if he's not responding to verbal, so I have to either rub on his sternum or pinch his earlobes to make him become conscious. So close your eyes. Okay, Ryan. And then he becomes conscious whenever I rub on his sternum, so that's pain, P. And then U is unresponsive, so I do all those things and he does not respond, then he's unresponsive. And then next we're going to do orientation. So for orientation, when you're checking a patient, you would do person, place, or time, and time. So I'd say, Ryan, what's your name? Or, oh my gosh. What's your middle name?
Andrew.
Where are you from?
Indiana.
Where were you born?
Indiana.
Okay. And what day of the year, or what year is it?
2020.
Okay, so that'd be person, place, and time. And then we're going to move to motor responses. So I'm going to have the patient squeeze 2 of my fingers, each separately. And then when I try to pull out, I shouldn't be able to. That's normal. If I can pull out, then that's abnormal. So sit up. Okay, now I want you to grab my 2 fingers with your right hand. Okay, as hard as you can. Okay, now let go. Now the other hand. Okay. Okay, so that would be a normal finding if I can't get my fingers out. Now we're going to do, and then we're going to do push. I'm going to push on his leg, and he's going to resist. So go ahead and try to lift your leg. Okay, and that's checking for motor response as well. Now we're going to do superficial touch, which is I'm just going to use a cotton ball over his entire body and touch different places, and he's going to tell me whenever he can feel it. He's going to say now. So
No. 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 No.
okay, so that's superficial touch, and now we're going to do superficial pain. So I'm going to touch him with a Q-tip for the dull touch, and then for the sharp touch, I'm going to use these scissors. And he's going to tell me which one's sharp and which one's dull. So, go close your eyes.
Dull. Sharp. Dull. Sharp. Dull. 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 Sharp.
Okay, so he got all this correct. Okay. Okay, and I believe that is it. Thank you.